Tonight on 10 Minutes, an exploration of fraudulent private stem cell clinics. In the United States, there are hundreds of clinics operating under the guise of providing groundbreaking stem cell treatments to unsuspecting victims. One such clinic, the Indiana Institute of Regenerative Medicine, is a textbook case of stem cell fraud, charging unsuspecting victims up to $4,500 for what they claim are miracle treatments. But how are they able to deceive so many patients? The reason is the overhyped capabilities of stem cells.
Though this hype surrounding stem cells is fairly recent, scientific knowledge of their existence is not. Bone marrow transplants are a form of stem cell treatment, and they have been performed on patients since the 1960s. However, though this scientific field has existed for over 50 years, there is still confusion among the general public as to the exact function and nature of stem cells. So what does a stem cell do, and what makes them different from other cells in your body? Most cells in your body divide into two exact copies of themselves. However, when stem cells divide, they have the option of either self-replicating or turning into a differentiated cell, like a blood, bone, or skin cell. While the type of stem cells found in human embryos can form any type of cell in the human body, adult stem cells are multipotent, meaning there are specific few types of differentiated cells which they are capable of forming. For example, an adult stem cell isolated from bone marrow is incapable of improving eyesight. While stem cells could potentially be used to treat many diseases and disorders, and there is ongoing research into potential applications, bone marrow transplants are currently the only FDA-approved stem cell treatment. No other types of stem cell transplants have been approved by the FDA, and therefore show no concrete evidence of success.
So why then do so many clinics claim to have new treatments that can cure diseases beyond the capabilities of a typical bone marrow transplant? To answer this question, we have to return to the source. Of Regenerative Medicine is a small, nondescript stem cell clinic based out of Fishers, Indiana. At first glance, the Indiana Institute of Regenerative Medicine, located at 11530 Allisonville Road, seems like a legitimate doctor's office nestled between a St. Vincent's Health and an IU clinic. However, as we look deeper, the clinic's claims of curing knee, hip, ankle pain, along with COPD, heart disease, and diabetes, all with the use of stem cells, seems too good to be true.
In our investigation, we actually visited the location of the clinic listed on their website, Facebook page, and Twitter account. Upon our visit, it became apparent that the Indiana Institute of Regenerative Medicine does not actually have its own offices. In fact, patients who wish to visit the clinic must make an appointment through Village Osteopath, another practice that Dr. Null, the only physician working at the Indiana Institute of Regenerative Medicine, is associated with. When we visited the location, we were informed by a neighboring clinic that Dr. Null's practice had moved a week prior, and no forwarding address was left with neighboring clinics or on their website. So, we tried to call the clinic during business hours for a new location, and were sent straight to voicemail each time. Interestingly enough, the only information the voicemail provided was a way to contact the billing company in case you still had payments to make. Multiple attempts at contacting the Indiana Institute of Regenerative Medicine through email and phone were unsuccessful. Since direct contact with the company and its employees was not an option, we moved into investigating the specifics of one of their treatments, given the meager information provided on their website.
One of the most common diseases they claim to be able to treat is type 2 diabetes. Type 2 diabetes affects upwards of 30 million Americans, according to the American Diabetes Association. Type 2 diabetics have developed a resistance to insulin, a hormone used to regulate blood glucose levels, and therefore have elevated blood sugar levels due to the inability to metabolize glucose correctly. Risks for developing type 2 diabetes increase with age, extreme weight gain, lack of exercise, and prediabetes. This disease can often lead to damage in all parts of the body, including but not limited to nerves, eyes, ears, heart, and kidneys. According to the Mayo Clinic, treatments for type 2 diabetes include healthy eating, regular exercise, possibly diabetes medication or insulin therapy, and blood sugar monitoring.
The Indiana Institute of Regenerative Medicine claims to have a better treatment which can regulate or even cure diabetes: stem cells. Under the Stem Cell Treatment tab for diabetes, their website reads, "Research has shown that stem cell treatments improved blood sugar levels in some diabetic patients. With the host of collateral damage that diabetes does to other body systems, such as the heart, the eyes, and the vessels, inflammation is rampant, and research shows that when stem cells are administered, they home to the area of inflammation in the body and then get to work. The website states that the clinic is unsure of the exact mechanism of the stem cells' action at these sites, but research has shown good clinical results. The website provides no references or results relating to this treatment, so we did some digging of our own. In a journal published by Nature Medicine, a reputable journal in the scientific community, researchers showed significant reversal of insulin-dependent diabetes using islets generated in vitro from pancreatic stem cells. However, it is important to note that this study used stem cells isolated from the pancreas, and the study was performed only in diabetic mice. So this paper provides no evidence that stem cells derived from adipose can treat diabetes in humans. Further research on the topic showed no evidence of any diabetes-related stem cell studies being conducted in humans. This leads us to believe that the Indiana Institute of Regenerative Medicine is using a fraudulent diabetes treatment.
So why are so many clinics able to make money with bogus treatments? It comes down to a lack of FDA funding and resources. There are over 600 possible fraudulent clinics in the United States. And in order to shut them all down, the FDA would have to investigate, file a case against, and bring to court each individual clinic. This is an impossible task for the FDA to accomplish. So it's up to us as citizens to become well informed about the dangers of such clinics. Always be a skeptic when looking into treatments offered by stem cell clinics, and inform others so that one day, well, there will be no one left to scam. I'm Hosley Werner. From all of us at 10 Minutes, thank you for tuning in, and good night.
The views and opinions expressed in this news report are those of the creators and are meant for educational purposes only. No harm is meant towards any of the subjects of the video.